Korea is marking its seventh wave of COVID-19, with the daily tally rebounding well above 50,000 infections. The death toll remains in double digits and critical cases above 300. So how severe does this latest resurgence look to be? What related safety protocols are in place for the college admissions test today? And when will this seventh wave peak? Welcome to Issues and Insiders. Today we revisit the ongoing pandemic as Korea faces its seventh wave amid the country's third annual college entrance exam. For more, I have Professor Kim Moon Kyu from Yonsei University. Professor Kim, it's good to have you here.
Thank you for having me.
I also have Doctor Kim Seung-taek from Institut Pasteur Korea. Dr. Kim, it's been a while. Welcome back.
Good afternoon.
Right, Professor Kim, we'll start with you then. So this year, test takers who have COVID-19 will be taking the test at separate testing sites and not at medical care centres, that is, with the exception of 3 test takers, of course. Now, some are concerned that this may lead to a resurgence after Suneung. What are your thoughts?
Well, before I mention about the test takers, I would like to briefly mention about the daily tally of Korea right now. I reviewed the 7-day average of daily tally, which is now more than 1,000 per million right now. It's increasing, and I think Japan is also increasing, but this kind of slope is almost similar to the 5th wave and 6th wave, which was in February and July. But the mortality is around 45 cases per day, which is not rising, but we have to see after 2 weeks because complications happens 1 or 2 weeks later. And the case mortality rate is very low, 0.09%, which is very good thanks to the vaccination and all the medical services. So let's talk about the exam. The students sit, they don't move around, they keep distance, they wear masks, and all the COVID-19 cases are taking tests in a different isolated room with quarantine measures. So I think the test itself is not going to be a big game changer or be giving a surge for COVID-19, this 7th wave. But after the test, the students might go out and enjoy the relief. And I don't know what's going to happen, but that's the time we should be careful. So I wish that those things would not spread out after the test, and that keep all the quarantine measures outside the test rooms.
Right, such as wearing your face masks indoors.
Yeah.
Dr. Kim, health authorities say that Korea's 7th wave may lead to as many as 200,000 cases a day. What are your thoughts on this, and how severe do you suppose this latest resurgence will be?
Well, I think the reason for that the government the health authority estimate maybe less than the 200,000 just cases is because the things are actually very similar what we are actually experiencing right now compared to the last wave, because there has been no the emergence of any substantially different just the variant. So there's no substantial just variant issues. Only thing that we can actually think about is our just population immunity. So then as I told many times before, like our immunity, especially the neutralizing antibody levels, doesn't last forever. It like after the actual infection or just a vaccination, it just just sharply declines after 2 or just 3 months after that. So now this time, and the last wave is like about just 3 months ago that we observed actually at just very close to 200,000. But now it's 3 months later, we are seeing the very similar numbers. But as Professor Kim said, we are not much concerned about this wave because our population immunity is pretty just good right now, and so basically just number of just severe cases and the mortality maybe slightly increased in proportion to the number of just confirmed cases, but we are not concerned much about just a certain just increase of any severe cases or just death. Also, we have to actually wait 1 or 2 weeks because the the progression to severe disease kind of 1 or 2 weeks after the onset of the symptom or just infection.
Right, as Professor Kim has said, of course.
Right.
And Professor Kim, in the course of the pandemic, ahead of every winter, we've spoken about the possibility of a twindemic. Now, this year, I understand we are worried about a possible triple-demic, especially for parents of young children. Could you tell us what a triple-demic is and how should we respond?
Well, because of COVID-19, we were relatively spared from influenza for about 3 years. And that does not necessarily mean that we lost the immunity against influenza. But still, there is a possibility that we might have a strong upsurge of influenza this winter, which might result in a twindemic. But till now, I encounter only few cases of influenza patients in my emergency department. So I'm going to wait and see what's going to happen. But actually, I see more infections from metapneumovirus, which is an yearly event happening in our country. So if there's any possibility for new upsurge of infection globally, I think we may have to quarantine travelers coming from other countries for 7 days. If we can prevent any infections coming from other countries, I think we don't have to worry about twindemic or triple-demic, something.
Right, I see. Dr. Kim, as we've said time and time again, prevention, of course, is better than cure. Now, that being said, what can you tell us a bit about the bivalent vaccines currently available to those aged 18 and above here in the country?
Well, first of all, I have to just talk about our vaccination schedule in Korea right now. So still the primary series of vaccination, which is actually about the first shot and the second shot, we still just recommend some monovalent vaccine that we actually use for the last 2 years. But for the booster shot, including the third shot and the fourth shot, now health authorities actually recommend the bivalent vaccine. The bivalent vaccine, which is actually a mixture of the 2 different vaccines. One is our original vaccine, and the second one is the vaccine against just Omicron variant, either BA1, this is earlier Omicron, and the BA4 or 5, this is some late Omicron. So this is kind of recommendation, but there's some additional just options that some recombinant protein-based vaccine, which include Novavax vaccine and then SkyCoV-1. Those are also just can be actually administered for those who are actually experiencing some adverse effects due to some mRNA vaccination previously. So there's an option, and then there is some for the bivalent vaccines. Actually any clinical efficacy is not really quite clear right now compared to the monovalent vaccine. Previously, when the Pfizer and the Moderna presented their data to some FDA or things like that, then mostly they actually show their neutralizing antibody titers, but the neutralizing antibody titers actually increase approximately 1.5-fold compared to monovalent vaccine, which is not really statistically significant. And then now there are some papers coming out, maybe, and compared to monovalent vaccines, this bivalent vaccine, especially targeting BA1 and BA4 and 5, actually does not increase in terms of, at least at this moment, is a neutralizing antibody, actually did not increase much substantially, but substantially more than the monovalent vaccine right now. So anyway, the bivalent vaccine and the monovalent vaccine, whatever it is, it still works.
Right, it still offers you protection, of course. Then.
Sure.
Professor Kim, I understand this might be a very tough question, but when do you predict will our 7th wave peak? And once it does, do you suppose we'll be able to take off our face masks when we're indoors once the weather becomes warmer?
Well, I have to say that who is getting this COVID-19 nowadays? Mostly people who are not infected are getting COVID-19 right now, and maybe I think because they keep the rules of quarantine very strictly, they were spared, but now they are more exposed than before. And also I see some reinfected cases also, but I am a bit surprised that I see patients who are never vaccinated so far. So I just urge them to get the vaccination, as Dr. Kim mentioned. And If you already had it, I recommend the people who are not infected to get a booster vaccine from the bivalent vaccines. And I think that the outbreak will continue until the virus picks out every person who are not immune against the virus. But we don't have to worry, because now we know what the virus is. We know how to treat it, and we know who is at risk. So we don't have to worry that much as at the time of the beginning of this pandemic. I don't know exactly when we're going to just lift the indoor mask, but the next spring might be the most possibility. But people who is sick has to wear the mask, and medical personnel who deal with infectious disease should wear the mask all the time.
Right, and at the moment here in Korea, our quarantine period for COVID-19 patients remains at 7 days, right? Yeah. Right, Dr. Kim, does Korea remain dedicated to developing drugs against COVID-19, or have such efforts been marginalized as we become more accustomed to this new normal amid the pandemic?
Well, as of now, all those, drug development and vaccine development is now, it's not just the number one priority in Korea, because one of the reasons is that there are many options already available that actually approved to just can be used for the patient. In terms of just the drugs, we have Paxlovid and then remdesivir and monoclonal antibodies and then molnupiravir. And actually, in Korea, we also have very successfully developed one treatment option. This is a monoclonal antibody developed by the Severity. But unfortunately, there were several successful monoclonal antibody. But the bad thing is that this monoclonal antibody is very susceptible to the variant. So the last monoclonal antibody that was very useful for up until some very recent Omicron variant was a bebtelovimab that was actually developed by the AstraZeneca. But the very recent Omicron variant is a BQ something that for that specific variant, now the last monoclonal antibody that was only available for the patient now lost substantial neutralizing antibodies. So in terms of monoclonal antibody, we have to actually, maybe we have to develop more a variant-specific monoclonal antibody. But other than that, monoclonal antibodies now is no more useful right now. But three other, Paxlovid, remdesivir, and then molnupiravir, still good, even for some very recent Omicron variants as well.
Right, I see. Professor Kim, speaking as a doctor who was at the front lines of the battle against the pandemic in the early stages, of course, do you suppose Korea's COVID-19 campaign has better prepared it for future pandemics, or is there room for improvement?
I would like to say about this pandemic and then talk about the future pandemic. Because of the MERS outbreak in 2015, I think Korea had a huge lesson. So we are a bit prepared for possible new pandemic. So we moved very quickly at the beginning. So that resulted in a very good result. Quarantine measures at the beginning. But the quarantine measure was not applied evenly, sometimes too strict, sometimes loose. So I wish that we can correct that mistakes, so we can approach the new pandemic in a scientific way, listening to the specialists. And now we have a subvariant called BQ1 or XBB, but that behaves similar to Omicron, so it's not that big worry right now. We learned that the ICU facilities was not that enough if there was a huge outbreak, and medical personnel such as doctors and nurses who care for critical patients was not enough. So if I move the topic to the future pandemic, I wish that we can have a reserved, facility reserved for possible pandemic, and also doctors and nurses treating critical patients. We should have a reserved and call them as soon as we have a critical situation. Monkeypox was mentioned, but now we don't talk about it because it is out of concern. But still, we need that kind of monitoring system. And recently, MERS patients occurred in Qatar, which is holding a World Cup soccer game right now. So that kind of thing is something we have to be
watch
concerned.
out for and be careful about.
And well, we also might have a new kind of influenza or a new kind of coronavirus. So that's the thing we should be vigilant about.
Right, we should be monitoring these cases, and of course. All right, Professor Kim, as always, thank you very much for your time and your thoughts. And Dr. Kim, thank you very much for your insights. Right, well, on that note, we say goodbye. Now, we'll be back same time tomorrow. That is Friday. Do join us then. Thank you for now.